Well, welcome to Close Up. We start by talking about the opioid crisis. It has claimed thousands of Granite State lives in the last decade and impacted the lives of many more family and friends of addicts. It's a battle, though, that keeps changing. While the synthetic opioid fentanyl still proves to be deadly, the newest concern is an even more powerful drug, carfentanil. David Mara has been on the front lines of the battle against the opioid crisis as police chief in Manchester and acting chief in Portsmouth. He's now the governor's addiction and behavioral health advisor, or the drug czar, and he is my first guest today here on Close Up. Thank you, first of all, for joining us. I know you're very busy. You've been on the job, what, for 3 weeks now?
This is the end of my third week.
Oh, wow. Okay, just started. So your background, obviously, in law enforcement. Your predecessor was a prosecutor. Does it help the fact that you've done this for so many years on the streets, if you will?
I believe it does. I believe it does. As a police officer, just as our police officers in the state are going through right now, you're right out there in the front lines. You get to see the devastation that this problem, does to families, to communities, and overall to kids, too. The effect that it has on children.
Now, from your experience back when you were with the police departments, how often were these calls when you went out involving drugs?
When I was out in the street, it wasn't anything like it was now. When I first started, the biggest problem was cocaine. And now you don't see cocaine out in the street as much or nearly as much as you did before. And I was around and out in the street when the crack cocaine epidemic hit. And that does not compare to this at all. This addiction is more insidious, and it's causing more, as I said, destruction to families and communities than anything I've ever seen in my 30 years of law enforcement.
Now, your job title is Addiction and Behavioral Health Advisor for the state. Give us some idea of what your task is, what you're hoping to accomplish.
What I want to do is I want to get information out to the community. I want to be able to tell the community this is what's going on, the good, the bad, and what we're doing about it. I also want to be able to help try to evaluate what we're doing as a state, treatment, recovery, enforcement, what is working, what isn't. Because with limited resources, we want to make sure that we're putting our money towards where we're going to get the best bang for our buck, what is more effective.
It seems, from my perspective and from a lot of people, it seems almost overwhelming. There's so many drugs out there. There are so many people dealing with this issue. How do you even begin that process? What are the first things that you even do? I know you're evaluating right now, but how do we tackle this? How do we stop it?
Well, it's the same formula. You have to, it's three-pronged. You have to go with treatment and recovery, education and prevention, and enforcement. And when we talk about enforcement, we're not talking about the enforcement of arresting people and incarcerating people for minor crimes that have the addiction problem. We're talking about trying to stop the people that are bringing this stuff in, that are bringing in fentanyl, carfentanil, knowing what it's doing to people, and they're still doing it to make a profit.
Now, the Attorney General's office has made it a priority to prosecute these people that have this so-called carfentanil, which is extremely powerful drug. Do you think that's the best way to go about this? We start at the top here, getting the most powerful drugs off the streets first, I assume?
I think anybody that's selling drugs, we go after them. And regardless of what they're selling, whether it's heroin, fentanyl, or carfentanil, when we have this many deaths over this prolonged period of time, this is a crisis, it's an epidemic, and we have to take very, very stern action to stop it.
You can make the arrest for these dealers, but there's still the demand from the users out there. Is there a way to stop it from that end of things? Stop people from wanting the drugs, stop the demand for these drugs?
Yes, there is, and it's about the treatment, and it's about the recovery. When we talk about treatment, we're not just talking about somebody goes into a drug treatment program, maybe for 30 days, 21 days, and then afterwards, they're not cured. It's a long process. Most people don't do it on the first shot. Then afterwards, there's years, if not a lifetime, of recovery. So what we have to do is make sure that the people that are being treated, that are coming out of treatment, they still have recovery. Because we have to stay with them. We can't let them fall. We have to try to do everything we can not to have them go back to the same environment they were in before they got addicted.
Certainly fall back into that pattern again. There are people out there who say, well, I don't know if treatment even works. You've been to some of these facilities. I know people are trying their best. Have you found that treatment for some of these drug users does work? Does it stick?
Yes, it does work. There are some very dedicated professionals out there across the state. In the 3 weeks I've had the opportunity to go all over the state and start talking to people that are right there in the front lines, that day after day they're with people that are addicted, and they're doing everything they can to make sure that they have the tools and the treatment to be able to fight the addiction. Everything doesn't just work. There's not just one-stop treatment for people. What might work in Manchester doesn't work up north. Doesn't work, might not work on the seacoast. So you have to find what works for your community, and that's what we're trying to do.
Yeah, and I'm glad you mentioned that. There are a lot of dedicated people fighting this right now. I know there are police officers that will give out their cell phone numbers. Say, call me if you feel like you're going to relapse. And I know there are a lot of dedicated workers trying to keep people off of these drugs as much as they can. Do you feel like right now we have enough beds, if you will? Do we have enough resources out there to help people get treatment if they want it?
We don't have enough beds. There are roughly 200 treatment beds throughout the state. And if you see the numbers, just looking at the numbers of overdoses that we have, you can clearly see that we do not have enough beds. We're working hard to overcome that problem and try to add beds, but it's something that we really have to work on. But there are other things that are going on. The governor has been talking about workplace. This crisis has affected the workplace. It has affected the number of employees that are available for businesses. And when somebody, as I said before, gets off a treatment, it's a long-term process. And people spend a good percentage of their time at work throughout their lives. So if they can go to a workplace-friendly recovery atmosphere where they're employed, it would go a long way. And as the governor has talked about, it's about training employees, human resources, how to make a place work recovery friendly.
Yeah, I mean, certainly good advice if an employer can help you out through that process. Have you seen other programs in other states where they have found tackling the drug problem, their method is working? And would you replicate something like that here in the state of New Hampshire? In
law enforcement, in both my positions as chief in Manchester and Portsmouth, I always am looking outside the state, in the state, to everywhere I can to find something that's working, and then see if it would work at the police department that I was at. The same thing fits here. If there's something working across the country, we'll definitely take a good look at it and see if we can adapt it to our needs here in New Hampshire. But there are some great things that are going on in New Hampshire as well. The safe, look what the Manchester and Nashua Stations program. Look what Nashua Fire Department and Manchester Fire Department is doing. They're having some success. It's making a difference. Yeah. If you look at Nashua, you have the Harbor House where people can go. It's a one-stop integrated. It has treatment, recovery, medical, dentist, you name it. And because when you're treating somebody, a lot of times it's not just that they're addicted, but there's also a dual diagnosis of mental illness. Yeah. So you have to treat both, and you have to treat both at the same time. So there are a lot of good things that are going on in New Hampshire.
Well, we have you. What do you make of the fact that the Manchester police chief wants people not to give people on the street panhandlers money because he's fearing that they'll just go out and buy drugs with it?
I think that's a great idea, and I think that's something that is very important for people to know. And that's about educating the public. Because in Manchester there's a lot of social services available. So it's not that these people that are panhandling aren't going to be able to eat or not going to be able to get services. This is all about, for the vast majority of them, just as the chief said, is to go out and buy drugs.
Yeah. What is your message to people out there who thinks these are addicts? It's their own fault for getting in this situation. Why am I spending tax dollars to help these people out? Why are we doing this for them?
Well, they're human. They're related to somebody. There's not too many people in the state that doesn't know of somebody that's addicted or, unfortunately, that has died from their addiction. So we have to do everything we can to help these people. Also, look at the effect it has on the state, on the communities. When you're looking at that person that is addicted, it doesn't just affect them, it affects their families. There are children involved, brothers, sisters, parents. So we have to do everything we can as a state, as a community, to battle this.
All right, David Marra, the new drug czar of the state. Thank you very much. I appreciate you giving us some time today. I know you've been very busy. If you know someone who is battling addiction and needs help, you can call the state's drug addiction crisis hotline. That number is 1-844-711-HELP. That is 1-844-711-4357. You'll also find that number and a list of other resources on the State of Addiction page at WMUR.com and our mobile app as well.